Hi, my name is Pebbles Thornton. I am the Director of Cancer Services, Palliative Medicine, and Hospice Care. Hospice care is end-of-life care that happens typically when someone has 6 months or less life expectancy. It's about dignity and providing care for someone in their home so that they can focus on their quality of life and spend time with their loved ones. We can come to your home and provide care. We can also have you come to our 7-bed freestanding Morrison House, which is our inpatient facility. That is for respite care, which would be if your caregiver needs a break, or if you are having symptoms that we cannot control in the home, then we can bring you in, get you settled, and then get you back home as well. People who are eligible for hospice care are usually in their latter part of their life. So they have 6 months or less to live expected. Anyone can refer to Genesis Hospice, or any hospice for that matter. Your family member, your physician, you just have to have a physician who can sign a certificate that says that you have 6 months or less to live. So Genesis Hospice provides comprehensive services for hospice care in the community. We have a team of social workers, nurses' aides, chaplains who also come together to provide comprehensive care for the patient. Only patients who are enrolled in Genesis Hospice can come to Morrison House. It is rounded on by our staff, and our physicians come in and check on the patients and make sure that they're doing well. So it cannot be used by any other hospice, but we do provide it for our Genesis Hospice patients. The Morrison House is open 24/7. Family can come and visit their loved one at any time of day. There's a beautiful chapel. It's a really lovely facility that is in a home-like setting for patients so that they don't feel like they're in a facility, which is unique to our hospice. At Genesis Hospice, we really care about the patient and their family and their experience, and that's why we are so proud to have our freestanding inpatient hospice facility that is unique to Genesis Hospice. We are a compassionate, not-for-profit hospice, which means that we're not out to make money in what we do. We're here to be there for the community and their loved ones during a time in their life that is mostly difficult for people. And so we pride ourselves that we're able to be there for them and make sure that our focus is on the patient. Hospices who are for-profit, their focus, while is on the patient as well, is also to make money. And so we want to make sure that we differentiate ourselves, that we are not-for-profit. All hospice care is covered by any insurance, including governmental insurance or private insurance. However, no one is turned away, regardless if you have insurance or not. We have a large backing from our community foundation, and our community has always supported our Genesis Hospice here, and so no patient is turned away for lack of payment. When you're considering hospice care, there is a website that CMS has. It's hospicecompare.gov that you can go to, and you can compare any local hospice in the area. You can look at what type of hospice they are. Are they for-profit or are they not-for-profit? Genesis Hospice is not-for-profit. You can also look at their quality of care. What kind of care are they giving their patients? Because that's important too. We want to make sure that your loved one is cared for, and we have very high scores at Genesis Hospice. And then finally, what are the patients and their family members saying about their satisfaction of their interaction with the hospice, right? And so that's also on that website, public knowledge, and we're very proud that we have high patient satisfaction scores at Genesis Hospice.